connection be between diabetes, insulin resistance, and hair loss?
A lot of times I like to explain to my patients, sugar in the body is a toxin.
Mhm.
Anytime you have any more sugar in the body that is exposed to any organ, any cell in the body, it is a toxin and it does damage. I like to explain it like those pinball games, those pinball games where they
Mhm.
have the little silver ball and you flick it and it just goes ding, 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 and it hits different things. You get points. That little silver ball is like sugar.
Mhm.
And each thing it hits is like an organ. It could be your eyes, it could be your heart, your kidneys, your liver, your hair follicles. But I just
Mhm.
need you to understand everything that sugar is exposed to in your body unchecked, it damages, it causes inflammation and it causes damages. Now, a lot of times when we are thinking about uncontrolled blood sugars and the damage it does to the body with diabetes, we think about the heart. We think about your risk for heart disease. We think about your vessels. Sugar in the vessels, attacking those vessels, it causes damage and the vessels get narrower. Then you
Mhm.
get decreased blood flow to different organs. We think about the kidneys and end stage renal failure, kidney failure. We think about the eyes and
Mhm.
glaucoma and how the sugars in the lens of the eye brings in water and damage. But a lot of times people don't talk about the hair follicle. So those sugars, the vessels, the same vessels that are going to your heart and to your kidney and to your liver are going to your hair follicle. And you can only imagine the attack that's going on that hair follicle,
Mhm.
the
Mhm.
inflammation at that hair follicle, the decreased blood flow at the hair follicle. What is going to grow? What is going to thrive? You want your hair follicle in fertile ground.
Right.
So when it's constantly with vessels that are plugged up like this and inflammation surrounding it, it's kind of like having a plant that's in dry, acrid ground. It's
Mhm.
not going to thrive.
Mhm. Mhm. And I think, and I'm in a couple of forums, and one of the things that almost consistently women who are dealing with hair loss say, whenever they increase sugars, they can immediately tell that the
Yeah.
impact on their hair or their scalp. How do we mitigate that, right? And so is it complete elimination of any type of sugar? Is it, because there's people say you can have you should not have refined sugars. Is maple syrup or honey, or what are your thoughts around how do we, which is I guess what we're talking about, how do we manage this unchecked toxin uh in our body?
I understand exactly what you're saying. So I wish I had my diagram because I like to use this diagram where I talk about how the sugars spike in your body. And when you think about that sugar spike, you can also use an insulin spike to cover that sugar, right?
Mm-hmm.
And the issue is how high that spike is, meaning
Mm-hmm.
how much blood sugar is in your bloodstream at any given time. And what you want to do is decrease that spike.
Right.
You want to have more of a flat line. Like if I wish I could draw it out, but if you had like a diagram like this, you would want your
Mm-hmm.
sugars to kind of be, ebbing around the same. If
Mm-hmm.
up here was red, you don't want that up and down spike. And what
Right.
causes
Right.
that up and down spike is, you know, I had a bowl of rice.
Mm-hmm.
Boom. You
Mm-hmm.
know, I had a bowl of ice cream and cookies. Boom. You know,
Mm-hmm.
and a lot of times it's not so much about rice is bad, cookies are bad. It's how can I mitigate that spike,
Mm-hmm.
right? How can I outsmart my body, outsmart my hormones, and not give them that spike? How do I not make it so that so much blood sugar enters my bloodstream at any given time? And there are hacks
Mm-hmm.
for that. One
Mm-hmm.
hack
Mm-hmm.
I really love is the meal sequencing, right?
Okay.
Because we know that carbs itself are not bad. But when you eat carbs alone, like if I just ate a bowl of rice,
Right.
I'm going to get that spike. But if I can, in a way, eat my meal so that that carb hits my stomach last,
Mm-hmm.
then that spike is blunted. So
Okay.
now eating the same meal, but you've tweaked it a little bit. So what we like to do with meal sequencing is I suggest that you have a vegetable, a protein or a fat, and a carb, and that
Mm-hmm.
carb needs to be eaten last. So let's
Okay.
say you have a meal where you want to eat rice. Well, you'll have broccoli on your plate. Then you'll have your protein, which may be fish or beans.
Mhm.
And that beans may be cooked with a little bit of butter, olive oil, or something like that, a little bit of butter. And then you have your rice. And once you start with that vegetable and that protein, when you're eating, your stomach is already releasing hormones like GLP-1,
Which
which
is
we talk about with semaglutide and all of that stuff that they're trying to increase, right? Your
right,
body
right.
naturally starts to release some of those hormones that are already working to blunt that spike.
Let's take a quick detour to the GLP-1s. So you're saying that, and I think I may have read this somewhere, like our body has naturally occurring GLP-1s.
Mhm.
And so there are ways that we can um, support the production of GLP-1s in our bodies, even outside of using a medication, and that's with our food.
Yeah. So let me tell you, a lot of the treatments that we have for diabetes and for weight loss are surrounding hormones that your body's already making.
Mhm, mhm,
There,
mhm,
it's literally based on your body's already physiologic uh, system that's in place. So
mhm,
when you talk about semaglutide and some of these other dulaglutide, Trulicity, um, they are GLP-1 agonists, and that they're helping to keep the GLP-1 along longer so that you can get
mhm,
the benefits from them. But your body makes those hormones, those
mhm, mhm.
enzymes. Excuse me.
Yeah. Mhm.
So what they're doing is they're keeping your GLP-1 there long enough so that you can get more effects from it.
Right,
But
right.
there are some things that you can do at home to increase that GLP-1 yourself as well. And
Let's
you'll
talk
see
about it.
one of them.
Let's talk about it. Let's talk about it. Let's go through those. Let's go through those things.
Yeah. So meal sequencing is a great one. You know, once you start eating those proteins and those fats, your body starts creating that GLP-1 and your body can utilize that, right?
Mhm.
Another good thing that can help with GLP-1 is, staying hydrated, staying
Mm.
active,
Mhm.
walking after those meals, reducing the inflammation, probiotics, creating a good environment for your stomach. So your stomach isn't um, all tore up. you want to keep you want to keep that stomach lining
Right,
healthy.
right, 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 right,
So you don't want to be eating and drinking foods that are caustic or that can be destroying that stomach lining. You want to eat. You just basically want to live in a healthy way, a healthy lifestyle, and prioritize drinking water, keeping your system flush, eating things in the right meal order. Another thing that can help GLP-1s are certain foods, right? Like kiwi, avocado, prebiotics, berries, strawberries. And if you eat some of these foods first in your meal,
Mhm.
you get that better effect. So it's almost like you're going to have to re-engineer and reverse how we've been taught to eat. Because a lot of times what you'll see people do is I'll eat my strawberries and everything last after my meal because that's sweet. Or I'm going to eat my rice first and then I'll eat my vegetables. Even though, some of our parents and the old folks told us you got to eat your vegetables first.
Right,
It's
right,
getting back to that mentality for the better. And you may even find that by the time you make it to that carb, you don't even really want it.
right, 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 right. Okay, that's helpful. Helpful.